Got interested in this work by accident. In 1999, I had an adverse medical event that had a profound emotional impact on myself, my family, and to my surprise, the care providers. I guess there's an assumption that we were all getting the support we needed, and we weren't. When we first started, there was no data. Over the last 17 years, there is reams and reams of data saying that there is an impact to clinicians following adverse events. There's a little less on the patient side, but the gold standard now for programs to support clinicians is peer support programs. And that's what MITS, the organization that I founded, that has been doing for several years. We have been doing it with different hospitals across the country. Now with the Betsy Lehman Center, I feel blessed that we're going to be actually able to do that in the Commonwealth of Massachusetts. And we are also at some point within the next couple of months going to start a statewide network of peer supporters for patients and families. The irony is, 17 years ago, I don't think we were calling it peer support. I knew I needed support, and I wanted to speak to somebody who had been through something similar, but I didn't know that that was called peer support. I did know that had I been a true cardiac patient or a cancer patient, I would have been inundated with resources for support, but because something went wrong and nobody was talking about it, there was no form of support. I remember making one phone call to the social work office to say, do you have patients like me that I can talk to? Because I knew in my other work that sometimes people just need to not feel alone, and that's what I wanted to. I felt isolated and alone. I think today most healthcare organizations are more than willing to think about support mechanisms for staff. The level of burnout, they actually have data behind this, which is something that they didn't have before. The burnout in not just physicians, but nurses and people leaving the industry, pharmacists. So the high suicide rate in healthcare. I think all this is a driver for healthcare organizations to provide support. However, they're not all doing it, and that's what we're hoping to do here at the Betsy Lehman Center is provide the support to be able to help them build the infrastructure for a support mechanism. And it doesn't hurt that the Joint Commission has made a recommendation that every organization have a mechanism to support their staff following adverse medical events.